All right. So, welcome everyone to the session two of Lean Healthcare Improvement Series. And today is going to be a very exciting session. Actually, I was thinking about, how do we take it forward today? What topics and how do I engage all of you so that you all can understand the lean waste in an environment, in a healthcare environment. So today we are going to cover five elements. First, we'll quickly go through understanding system thinking. What does it mean in a healthcare environment, in a hospitals where we all of us work, or some of us would want to work. Then we'll deep dive into the lean principles part. What are the five lean principles? Then we'll break down the definition of a lean. Then we'll go through lean waste. Some people, list it as seven waste. Some people take it as eight waste as well. We'll look into it. And then last, we'll go through a lean waste exercise that will sort of test our understanding of lean waste. So this is how the flow would be today. And to begin with, let's start with the system thinking. So when we say system thinking, what does it mean in a healthcare? And I just want to start with an example of patient waiting in ER. So how does the system thinking applies to it? So let's say the patient is waiting in ER to be seen by the doctor, right? This is why the patient goes to ER. If we ask the question why the patient is waiting in ER, the next answer could be usually what will happen that when you go to any hospital and the people who don't understand the system thinking part of healthcare, they would immediately jump onto conclusion and say that we need more beds because of shortage of beds, the patients are waiting outside. Or some of them would say that we need more doctors, we need more nurses because we are short on staff. So that's the reason we are not able to serve the patient as soon as they come. But let's drill down this. Why the patient is waiting in ER to be seen by the doctor? The reason is that because the beds are not empty, right? Fair enough. This is where some people would say that, we want to add more beds. Now, let's drill down further and ask another why. Why beds are not empty? Because some of the patients are waiting to be admitted to the inpatient ward. That's the reason beds are not empty. Fair enough. So at this point of time, again, some people say that why not we add more beds? But let's ask another question. Why patients are waiting to be admitted to the inpatient ward? Why? Because inpatient wards are not available. Fair enough. Because they cannot be moved. So that's why they're just occupying the ER bed. Now, at this point of time, people would say that, we're short of inpatient beds. Let's increase the capacity by 20% to 30%. And that way we will be able to move patient faster from ER to inpatient. But let's ask another why. Why inpatient wards are not available? Because patients in inpatient ward are waiting to be discharged. That means we do have patients whose beds can be used, but those patients are waiting to be discharged. That's the reason those inpatient beds are not empty yet. So let's ask another why. Why those patients are waiting to be discharged? And let's say two patients are having billing issues. And let's say one patient has medication issue. So that's the reason these three beds, for example, in this case, which we could have made available to the ER patients, are not made available because we have two patients with billing issues, one patient with medication issues. Now, another asked why Let's say for billing issues. Why those people are having billing issues? Because system did not capture the right charges. So that's the reason that, uh, sorry, just hold on. Somebody just dropped me a message. Just hold on. All right. So now because system did not capture the right charges, now you can see the story where we started. We started with the patients are waiting in ER to be seen by the doctor, and somebody would have jumped to a conclusion that let's add more beds, more capacity. Somebody would have said that, let's add more doctors, more nurses. But when we drill down, we ask multiple whys. We figured out no, they're not waiting because the beds are not empty, not sufficient in ER. They're waiting because they're moving. The patients are waiting to be moved to inpatient wards, but they cannot be because inpatient wards beds are also not available. But again, we could have said that why not add more inpatient beds, but that wouldn't have solved the problem. The real reason is that because those patients are not being able to discharge because couple of them have billing issues, couple of them have medication issues, couple of them might have had another complications. So the point of showing this exercise is that where we see the problem, wherever area in a hospital, it does not mean that we have the root cause of the problem lying there. The root cause of the problem could be sitting somewhere else. So we started with ER where the problem started, and what we realized that the problem is not with the ER, the problem is with the discharge process. Fair enough. This is what I wanted to demonstrate with this example, and this is what does it mean in a system. When we say system thinking in healthcare, you keep on hearing this word in multiple articles. We need to apply system thinking, we need to apply system thinking, but this is what does it mean. So we need to look at all the areas in hospitals, not in silos, but a system, but different elements of a system interacting with each other. Like in an automobile, we have multiple parts and we have so many electronic equipments, we have mechanical equipment, we have electrical equipment, and all of them are interacting with each other. So one part which is not working may have an impact on some another part, but as a whole, what may happen that the car as a whole may stop working, not because of something which happened in that particular part, but because of something which might have happened some other area of the automobile. For example, if you're driving a vehicle and say it stops working because now it is heating up, you may ask question, maybe your cooling system is not working. But the problem is not there. When you ask why your cooling system is not working, because so and so part had a wear and tear, and you may ask other why the part has wear and tear, because it has exhausted its whole life. So why it has exhausted and not being replaced? Because you did not follow the service schedule of the car. Why you did not follow the service schedule of the car? Because you were not made aware of. Why you were not made aware of? Because you when you bought the car, and when the person was selling you the car, introduced you with the features of the car, he did not talk about how to maintain your car. So the car breaking down on a road has nothing to do with what happened there, but it has everything to do with what happened actually when you bought the car. Sometimes the problem is somewhere else, and the root cause of the problem could be somewhere else. So if you don't fix the root cause, the problem will keep on coming up again and again. This is what the system thinking in healthcare mean. I hope this concept is clear now, and we can then move forward. If you have any question, just please raise hand and you can speak. All right, let's move to the next part. Now, this is what lean helps us in understanding. So when we say lean, I'll come to the definition of lean, but before the definition of lean, I want to talk about the lean principles. And I want to understand lean as we saw in the first session, we understood about the history of lean, and we understood about the mindset of lean thinking. Now, this history of lean and mindset, actually, if we just synthesize everything and we want to make a short, crisp summary of what lean is, we can summarize it in 5 lean principles. So lean principle, the first lean principle is specify value. So what is value? So value is understand what the patient, now in our case in a healthcare, the patient is a customer, truly values and willing to pay for in terms of time, outcome, experience, and everything else that patient is not willing to pay for is a waste. I think it's a very, very important definition. I'll repeat it again. As a customer, myself, yourself, anybody else out there doesn't need to be healthcare, but a customer of any service. We as a customer define something as value add that we are willing to pay for, right? If you say that, sir, you need to pay for sitting in a chair in a waiting lounge with an AC and with cookies and coffees being served because this is an expense to us. And as a customer, I would say that no, I don't want to pay for this service because this is not the reason I'm here. I'm here to get some service delivered to me, and I'm not here to sitting in a comfortable sofas and having coffees and all that. So that is not something which is adding value to me. So I'm not willing to pay for it. So that's not what customer wants. That means it is a non-value added activity. For example, you say that, sir, uh, we are charging you another $10 because we are keeping some premium just in case something happens to your car. If something goes wrong, we are taking this amount, we'll fix it for free. And I would say as a customer, no, I'm not willing to pay for it because when I'm asking for a car, I'm asking for something which is really reliable, which doesn't break down often. So why would I pay for something that is not adding value to me? So that premium, that thing, for repairing the car in case something happened is not something which adds value to me. So I'm not willing to pay for it, and that's a non-value added activity. So this way we need to sort of pass the activities and tasks through a screen and ask a question: is the patient willing to pay for it? If a patient is not willing to pay for it, and don't think as a patient someone else, just think about you as a patient as well. If you're a patient, will you pay for it? Are you willing to pay for it? Because when we go in a hospital, everything is a resource, and resource has a cost attached to it. When you go to a reception, there's a receptionist sitting serving you. When you go to a doctor, there's a nurse before the doctor serving you. Then there's a doctor. Then there's a vital machine being used by nurses. Now, if somebody asks you, sir, we have a very high-tech vital machine that we brought from Sweden and from New Zealand or from Europe, and it gives you your blood pressure with 99.99% accuracy, and that is the reason instead of charging $50, we are charging our patients $100. Now, as a patient, why would I care about 99.99% accuracy when actually another vital machine which gives say 98% accuracy but cost 50% less than this? So no, I'm not willing to pay for it. That means it is not adding any value to me. So this is how you look at different things. Now, why it matters? Because this specify value principle, this is where it starts. This is where the thinking starts. Is it a value add activity or a non-value add activity? It focuses efforts on what truly matters to the patients and leading to better outcomes and satisfaction. The second is, now we understood what the value is, what the customer is looking for, when the patient, let's say, is coming to a hospital, or a customer is going to a bank, or a customer is going to a mall for a shopping. Now, when we understand the value, so we need to understand how the value flows. So the second principle is map the value stream. Identify all the steps, actions, people, information flow that is currently required to deliver that value from start to finish. When we do this value stream mapping, it will help us identify everything that happens right when the patient enters the hospital until the patient leaves the hospital. And it doesn't start when the patient is in the hospital, but rather it starts even before the patient comes to hospital. Maybe it starts with the booking itself, booking for the appointment, coming to parking, finding the parking space, coming to the hospital, doing the registration, going to the vital, and so on and so forth. So we need to identify all the steps. And this is usually done through value stream map. And value stream map is one of the powerful tool in Lean. And in one of the session, probably third and fourth session, I will have a dedicated session for value stream mapping. The value stream mapping is a very, very powerful exercise to understand how the value flows from a customer point of view. Now it makes the entire process visible. It highlights the delays, bottlenecks, and non-value adding activities. So once you map the value stream, the next principle says that, all right, now you know everything how the value flows. You know everything where the value is not flowing, where the bottleneck is, or you also know what activities are not adding any value. So at this point of time, what you do is you start thinking about how do I maintain a smooth flow of value from start one to start uh, uh, end, from start to end. So how do you eliminate delays from the process? How do you reduce the lead times? How you eliminate the errors being made by different people? How do you make process flow smoothly like a river, like a water flowing without any bottleneck, right? So this is what you start thinking. So that third principle is create flow. Make the value creating steps occur in a tight, smooth sequence without interruptions, detours, or waiting. Eliminate batch and queue mentality. What happens? I'll explain batch and queue. The batch and queue is, I think it is very easy to understand from other industry example. Let's say you go to a bank and you apply for a loan, and the loan process is usually you apply for a loan, somebody looks at your application, somebody approves the application, and then somebody make a decision whether to give loan or not loan. Now, what happens is in a banking, multiple people apply for a loan, so they create a batch. Now the 50 batch, 50 application. Now this 50 application will again go to another station, 50 application. He will go through one by one, one by one, one by one, one by one. Then it will go to another station, one by one, one by one, one by one. So when we do things in batches, it delays the whole process. Let's say in lab, what happens in lab? You go and you give your blood to phlebotomist, and then phlebotomist, instead of sending the tube, sometimes wait for more tubes to be collected. Now your tube, which was sent, which was, the blood was collected, maybe say 60 minutes before. Now it's just waiting on phlebotomist table because phlebotomist is waiting for a batch of 10 to be collected. Then the phlebotomist actually will take, either it manually to the lab station, or maybe dispatch it through the pneumatic tube. But let's say there's no pneumatic tube. Let's say this hospital is a very traditional hospital. So what will happen? Now it doesn't make sense for a phlebotomist to collect one blood sample and go, or maybe go himself or ask a porter to take that tube to the lab in a hospital centralized lab. But rather, the phlebotomist will wait to collect a batch of 10. Now, when the first sample was collected, second sample was collected, third sample was collected, all of them are waiting, 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 waiting to be processed until the 10th sample is collected. Then the 10 batches go together to the centralized lab, and then they will start their testing one by one. One, two, three, four, five. Now it delays the whole process. what lean focuses on is a single piece flow. Don't do batch processing. What lean is expecting is that when you have one sample collected, make your process such that you deliver that sample to the centralized lab. Now, in let's say the hospital has a pneumatic tube, you collect one sample and you put that in a pneumatic tube, and the capsule goes to the lab. The lab starts working on it, so nobody waits. Nobody is waiting for another sample to be collected, and the third sample and fourth sample. So this is what single piece flow means. And lean advocates for a single piece flow. This is what create flow means in a lean environment. And it reduces delays, it shortens lead times, it improves predictability and make processes more efficient. Now, another principle is establish pull. The lean focuses on not producing something which is not required. Let the patient need, demand, pull work through the system. Don't produce services or information before it's actually needed by the next step or the patient. Let's say again the doctor visits sorry the patient visits a doctor, and doctor do some assessment and realizes, okay, we need to do a CBC, and then think, oh no, I think maybe later on you need to do vitamin D as well, or maybe you need to do vitamin B12 as well, so why not to do it right now? So now we're pushing something which is not required at the moment, which is like a push system. And push is something which is not advocated by lean at all. Lean advocates the pull mentality. Do only what the patient needs at that moment of time, what the customer needs. So if the customer needs CBC, do CBC. Don't add so many services which is not required. Because what happens when everyone starts doing the same, it puts lot of pressure and constraint on the system. The other services, medical imaging, lab, and say pharmacy, they are asked to do so many other things which they should not be doing right now. It puts a lot of pressure on the system. So if they're sitting idle, which is absolutely fine, but we don't need to burden the next step by doing things which is not required at the moment. So this particular principle, establish pull, it prevents overproduction of services, unnecessary tests. You don't need to do test right now, so don't do it, right? It reduces the work in progress and it minimizes the inventory. For example, now the procurement says that we are using so and so consumables, needles, cannulas, and instead of relying on the actual data, actual consumption. If the procurement says that we might need 1,000 of these needles next week, so let's order 1,000 needles. But that's like a push on the system. It's not a pull. The pull is knowing how many needles are being used on a regular basis and only ordering that much of inventory which is required. Now, how it helps? It prevents us from accumulating excess inventory. So the lean always works on a principle of pull. Do only what is required. Don't do anything which is not required. And there's a signal that comes from the next station, which shows a gap, and then the previous station performs only that activities which is to fill the gap for the next station. And the last principle is a very, very beautiful principle which talks about you you never stop improving something. You keep on improving. There's always an opportunity for improvement. So it is about relentlessly seek to improve every aspect of the process by continually removing waste and enhancing value. And it's an ongoing journey. It's not a destination. So this kind of mindset is required that if you, I don't know, we spoke, I think we spoke about the Formula One race pit stop in the last session. If they would have stopped, that our pit stop takes 52 seconds now, which is very fast. We cannot improve it further. They wouldn't be able to improve it to 1.8 seconds. They started with more than a minute. They came to 50 seconds, 40 seconds, 30 seconds. Now they're doing the pit stop in 1.8 seconds, less than 2 seconds. The reason is that they kept on challenging the process. This is the last principle is you identify the value, you map the value stream, and we'll understand this value stream mapping exercise in one another session. You create flow by eliminating any step from the value stream map that does not add value. And you do everything based on a pull, not on a push system. And then you continuously keep on improving it, continuously keep on challenging the status quo. So these are the five beautiful principles of lean. And now I'll move to, because now you understand lean, I'll move to a breakdown of definition of lean so that when you explain it to someone else, or let's say you yourself is trying to understand what lean is, it is very clear to you. And here I want some sort of engagement from you. So you may unmute your mic. So I want to ask you, what is lean? Please speak. Or instead of lean, what is lean thinking? What is lean thinking?
Eliminate unnecessary steps.
Elimination of waste, right?
Yes.
Perfect. So my question is, what is waste? What is waste?
Non-value things.
Excellent. Anything that does not add value to the customer, or let's say patient, right? Fair enough. So the lean thinking is elimination of wastes in a process. And waste is anything that does not add value to the customer. Now, the another question comes is, now we're breaking down this definition. What is value?
Anything that the patient deems as value, or
So what is value? Again, that's a good answer. I want more of you to answer this. What is value?
Anything the customer is willing to pay for the services.
Perfect.
Something.
Perfect. Anything
Services.
that customer is willing to pay for. Okay, which is good. So we are actually now breaking down the definition in a very nice way. I'm really happy with this. So what the customer is willing to pay for? What customer is willing to pay for?
Services.
Sorry, come again.
The services. The service.
Services.
Outcome.
Exactly. Services. Outcome.
The cost of this service.
Sorry, come
His
again.
needs. His need.
His needs.
or experiences.
For their experience, needs.
Needs. Now we need to understand this is very, very subjective, right? Services. Let's say my question is that a beautiful launch is a service in a hospital. Is patient willing to pay for this?
No.
No,
Is this the patient coming to the hospital?
not for the beautiful lounge.
Okay, perfect. Why the patient is coming to the hospital?
For the medical services.
Correct. Let's say see a doctor, get the services delivered.
Be
Now,
honest
let's
with you
say
guys, unfortunately, people they come for beautiful rooms and for doctors as well. Both of them it's neat. But I agree with you, they are not coming only for this, they came for both, yani, together.
I get it. So so which is absolutely fine. I mean, this is how, this lean thing helps. So now I'll do one thing, and this will then help us understand why I'm saying a beautiful launch is something. Okay, if a patient, let's say you have charged Saudi Riyal 500 to a patient, and okay, I'll not start with this, but I'll start with another example. I'll start with another example, and then we'll understand this. So you bought a car. The car was, say, Saudi Riyal 50,000. Okay. Now somebody was, a customer was so much into details, and he wanted to understand why 50,000, why 50,000. It doesn't look to be 50,000. I want to understand why 50,000, why 50,000. And they said, it took us process 1 plus 2 plus 3 plus 4. We did material, we have resources who were used, we have technology, and it all took us 45,000 to do this, and which is absolutely fine. And then what happened, that when the final inspection was happening, we found a defect in the car, and we have to fix it. And it costed us 5,000 Riyal extra. So, sir, that is the reason this car is costing us 50,000 Riyal. So tell me what the customer is willing to pay for. What will you do as a customer? What are you willing to pay for? 50,000, 45,000, or what?
I think it's very vague to say I don't want to pay the 5,000 extra for my future insurance. It's like insurance, you know? Okay, you try charging that much for the future, take it. I don't want to be worried about at that time the expense will come. So honestly speaking, I would love to have 45, but um
No, this
the
is this
five
is not for insurance. This is for final inspection. They mentioned that when the car was ready, we realized
yeah.
that the door has a defect, and
Oh.
we had to fix the defect. And
al-
fixing the defect took us 5,000 extra Riyal. That is the reason we are charging 50,000 Riyal for this car. So as a customer, what are you willing to pay for?
I would go for 45 because that was your problem. Your team didn't do the work right. So why would I
Exactly.
pay extra?
Yes. So this is now so this is what, and this is a reality, by the way. You would not know in an organization, but when we charge a customer a certain price, it includes two types of costs. One is value add cost, and second is a non-value add cost that we would not know, but this is how organization works. Now just imagine, if there's an automobile company A, and there's a automobile company B, and this A has perfected this process. He has understood that if I do certain things, I will never be able to make this make this defect. So basically he can produce this car in 45,000. The company B is struggling, and what the company B is doing, the company B always makes this defect, and it always take around 5,000 to fix that defect, and it always cost 50,000. So which company has advantage now in terms of selling it to the customer?
B.
No, the A, because
Company
A cost is 45,000, B cost is 50,000,
Oh,
because this contains VA value add cost plus non-value add cost, right? So this A company has an advantage. Now, this company can choose to sell this in 48,000, still less than 2,000 than company B, and make a profit of 2,000 on each vehicle. And this, if they decide to make a profit of 2,000, they need to sell it in 52,000, which is clear disadvantage over 48,000. So the intention of giving this example is that when now let's say a customer say, we ask customer the doctor's fees is, this service delivery fees is 500 real. Now, and the customer is also very detailed oriented. He want to ask, why 500 real, why 500 real? And I want to understand why 500 real. And let's say for simplicity, we say doctor fee is 400 real. Then we have, a beautiful launch plus services that cost us 100 real. That is the reason we are charging you 500 real, because anything in a healthcare is a cost, nothing is free, right? We when we do a modeling in a hospital, we decide the price of a service. We take into everything into account. We add a direct cost, the salaries of doctors, the salaries of nurses, uh, the equipment cost, depreciation cost, the space and everything. But I'm just, for simplicity, I'm saying that everything is basically cost to deliver a service. Now, if we give this breakup, let's say, to the patient, so the 500 real because of this doctor fee plus a beautiful launch and plus the services we deliver. So what do you think as a patient is willing to pay for? We don't give this breakup. Of course, we don't give this breakup. But let's say you start giving the breakup to patient. What would happen? What patient is willing to pay for?
400.
Naturally, right?
100. Yes.
You know why? Because as a customer, they think this is what they expect. This is what they think as basics. This is what defines the value in their mindset. Now, just imagine, because of course, a hospital with an ugly launch and a hospital with a beautiful launch, who has an advantage?
beautiful.
Beautiful, right? So it has an advantage. And this has disadvantage. So to Dr. Boyle's point, of course, patient would not go to a hospital with the ugly launch. We need to deliver this beautiful launch, and it has some fixed cost. Correct? Fixed cost of sofas, fixed cost of coffee, or other snacks that you're delivering. So you cannot do much about it. Either you can make quality inferior, but that would make it ugly, not beautiful. Now it has a fixed cost. Where is the variable cost? The variable cost is, say, plus medical services. Let's say this is where an opportunity is, where we can say it's a variable cost. So what you can control in this case, you still need to charge 500 and you still need to remain competitive. Of course, you would not tell a patient that this 500 real is doctor fee plus medical services plus the cost for a beautiful launch plus the coffee and all that, because as a patient, he would not want to pay for this 100, not at all. Try this with telling this to even a VIP patient. Once somebody would come to know the cost of something, which is not adding value, because this is what the customer thinks, adding value. And if this is not adding value, he would say that, boss, I'm okay with a moderate launch, but I do not want to pay for this extra 100 real. Some customers would pay for it, but those are like very rare, 5% of a very upper class VVIP patient, let's say. But 95% would say, no, I do not want to pay for it. Now, from a customer point of view, this is not, as we says, delivering the outcomes. The launch is not something which is delivering the outcome, but it is definitely delivering the experience. And outcome is always greater than experience from a patient's or customer's point of view. You would not want to have a very amazing experience, a very bad outcome, but rather you would still be okay with a very good outcome, but a little bit of moderate experience. So
Then
this
we
is,
need to create the need for that.
yes.
We have to make.
So this is why I'm trying to put this in a way that we need to balance things. Of course, we cannot go in one direction, but we need to always understand when we say what the customer is willing to pay for. The customer is willing to pay for outcomes, outcomes, outcomes. Want to see a doctor, good outcome. The customer is not willing to pay for you making him wait for another 30 minutes. You customer is not willing to pay for because you have a very beautiful kiosk in a hospital that give 10 different information to a patient, and which is why let's say you're adding another cost, say plus 50 real, because you have very amazing equipment. From customer point of view, patient point of view, this is still a non-value added cost. So we need to balance things out. That is why when I say value add and non-value add, it is a pure black and white thing. So we cannot make a beautiful launch and ugly launch, but we need to figure out how can we best optimize the overall experience and at the same time focus on the maximum outcomes, which is what adds value to the patient. So here we go. What is a lean thinking? The lean thinking is elimination of waste in the process. What is a waste? Anything that does not add value to the customer. What is value? Anything that a customer is willing to pay for. What the customer is willing to pay for? Willing to pay for services, willing to pay for outcomes, willing to pay for experience and other needs. But outcomes is the first thing that comes to the patient's mind. So this is how we need to think from the patient point of view. So we'll just quickly move to another thing, lean waste. In lean thinking, we have eight types of waste. Can you tell me what are those waste? You know it, if you have understanding of those wastes. The first waste is transportation waste. What is a transportation waste in a hospital?
Include the parking.
Unnecessary movement of material or people. You know what? For example, you have a patient in ED, you want to do a medical imaging. Medical imaging is on the other side of a hospital. You take the patient to medical imaging, then you're transporting something. So then you're taking the patient for lab. Lab is on other side. And let's say you're asking for some material. The material is coming from the warehouse. So all those movement of material and people, across the hospital, it does not add value to the patient. It does not add any value to the customer. So this waste is unnecessary movement of materials and people is called a transportation waste, because it add. See, when the nurse is taking the patient, say from emergency department to a medical imaging department, and the imaging department going to medical imaging department takes another 10 minutes. So it's additional cost to the business. That 10 minutes of a nurse multiply by hundreds of patients being taken in a hospital on daily basis. That means thousands of minutes and hundreds of hours wasted in transportation, which does not add any value. This is a transportation waste. So when you will do a value stream analysis, we will see that sometimes the lead time of a patient from start to end involves lot of transportation waste. Because let's take another example. When phlebotomists collect a blood, and let's say they don't have a pneumatic tube, so a porter needs to come. Porter needs to collect, say, the blood from different phlebotomy areas in a hospital, collect them in a box, and then take it to the centralized lab. Now all of this exercise, let's say, take 30 minutes. Now that 30 minutes has not changed anything, has not added any value to the customer, added value to the process. So that's a transportation waste. So we need to look at those waste in that kind of a mindset. What is the another waste? The second waste is
Inventory.
Inventory.
inventory waste. What is inventory waste?
Like whatever the
Sorry?
things we are using, for example, in a rooms like a slippers and all that.
Yeah, things waiting to be processed. So it could be a materialistic thing, but inventory is anything that is waiting to be processed. For example, you have 1,000 boxes of paracetamol, and you're using this 1,000 boxes in a 6 month period. Let's say, for example, now whatever boxes you will use in the 6th month, you have it right now. That's a waste, inventory waste, because it's a money stuck in the system. Any boxes that you're going to use in 5th month is sitting right now. It's also inventory waste. Now, it's a very outlier. Usually industries, how do they tackle inventory waste? You would read up, and even healthcare is also doing it. Of course, we may challenge it. What if this happen? What if that happens? And that is the reason, we have buffer some time. But many industries are moving to just in time. For example, I was working in industry where actually we are having an assembly line, and which use multiple parts for making a product. The parts are not stored in the warehouse. The parts are not stored in the factory. The parts arrive just in the morning of the production based on production plan. So you don't have any inventory. You have smaller inventory just in case there is a buffer, but you would have everything arrived when actually it is used. This is inventory waste. Now, the idea of all of these understanding waste is not to achieve perfection. Of course, what will happen, if a road blockage happen, what happen if there is a rain, what happen if there is a flood, these kind of things are outliers. So, but we need to understand in a concept of how do we minimize the inventory, because it's a waste, it's a things waiting to be processed. What is the next waste?
Waiting time.
Okay, I'll go in a flow that will make it easy. Motion waste. Now, just imagine a nurse has to enter, say, vitals in EMR, and it has, say, 15 steps. So, entering vitals, of course, it is important, right? But 15 steps is a motion waste. So what would happen? Just imagine if it takes 2 minutes for a nurse to do this, move here and there, move here and there, click here, save it, copy it, paste it. It's a motion waste. So you multiply that 2 minutes by the number of patients, which can be in thousands. Let's say your hospital sees 2,000 patients. That is 2,000 multiplied 2 minutes, 4,000 minutes wasted in vitals, entering vitals. Now let's say you are able to minimize this 50 steps to 7 steps. Immediately, every day, you're able to save 2000 minutes. So the motion waste is another example of motion waste is that when an inpatient area, the nurses has to pick say multiple consumables. One consumable is in the right side, the another consumable is on the left side, the third consumable is 50 meter in another storage area in a cabinet. Now the nurse is running here and there to collect all those consumables to be used for inpatient, and it's a motion waste because at this point of time it is not adding any value to the patient. Now just imagine how many nurses are doing this activity and multiplied by number of patients, number of times in a week, number of times in a month and a year. It's thousands and thousands of minutes and hours wasted in motion waste. What if we make entering vitals in AMR very smooth process, a 7-step process, 5-step process, 3-step process? What if all the consumables that are being used by nurses are placed in one location, right? So that nurse doesn't have to move to multiple location. You eliminate the motion waste. So this is the concept of motion waste. What is the next waste?
Waiting.
Errors
Waiting, I
or
will,
defects.
yeah, I'll go in order. You will see the order. When I say order, you will understand at the end because it will make it easy for you to. So waiting,
I
I
think
don't need to. Yeah, sorry, please.
it's a team woods, right?
Oh, yes, exactly. So actually it's team wood. So just imagine team wood is a person you want to eliminate. Add team woods. So this way it will make it easy for you to understand uh, all the 7, 8 waste basically. So it's waiting. Waiting, I will not go into it. Waiting is a pure waste. Anything waiting to be processed, patient waiting, sample waiting, request waiting,
Approvals.
approvals, waiting, anything waiting is a waste. I'll not go into it because it's self-explanatory. Then we have overproduction. What is overproduction waste in a healthcare? I have a very
Like
beautiful
like
video
pre
after this session.
like
Yeah,
pre-cooked meals.
I'll say ordering more than required, collecting blood more than required. What else overproduction waste could be? When actually you're doing things which is not required. And it is a cost to the hospital, and more or less it is a cost to the patient, right? When you do more than anything, what is the next waste?
Over processing.
Overprocessing waste. What is overprocessing waste?
Like using the complex
Complex matrix.
methods. Like we
Okay.
can do this. For example, we have to take the approval from the director or the manager for certain things.
Yeah.
So, but
Oh,
we are
yes, exactly. Multiple approvals. You're right. Absolutely right. This is a very big waste in any setup, not just in healthcare or processing waste. Let's say, sometime, though I don't usually go into the doctor's domain, but have you seen some doctors being very efficient? They see the patient in 15 minutes and the patients are really, very, really, very happy. And some doctors, end up taking 30 minutes and then they give a reason that I need to be very thorough, I need to understand everything and it takes time. But when you compare the outcome of both the doctors, the outcome is almost same, and sometimes even the doctor with a 15-minute consultation time is more efficient than the another one with 30-minute consultation time. Maybe sometimes doctors are doing over processing. If I go and say that I have a headache, doctor may even start asking me. I'm not challenging the clinical questions, I'm just giving an example for a thought process. And doctor may start asking me so many other things which may not be related to the problem and end up taking 30 minutes. It's like an hour processing, right? Same way, same way as I said, blood tests. A doctor may ask you to do multiple blood tests where actually a single or couple of blood tests are more than sufficient. Maybe where actually an X-ray is sufficient, a doctor may say to do what? MRI. Now, MRI is an overprocessing because I hope some of you are very well aware of. Sometimes we say that the X-ray was more than sufficient. Why we need to do MRI? But then it depends on doctor. Sometimes we ask to do extra things, which is an overprocessing, which does not add value to the patient, add value to the hospital. What is the next waste?
Defects.
Defects. Can give any example? Medication errors,
Medication errors, documentation errors,
documentation errors, wrong site, surgical site, say surgical infection, wrong label,
dietitian.
wrong label, right? So many other things. I mean,
Yes.
it all happens in a hospital. Anything which is not right first time and say defect, always remember which is not right first time is a defect. What is the last defect? It's already one, but we'll take just 5 more minutes and we'll complete the exercise. What is the last defect?
Skills.
Skills non-utilized, right? Sometimes we have a very potential candidates with a very good skills in a hospital. Let's say receptionist, very good in data analysis, but not being used. I'm just giving an example. So we have multiple people in a hospitals who are very good in many other things. For example, nurses having very good ideas, but not implemented. So that's a skills non-utilized. So the lean, as we move forward, when we will do a value stream mapping session, it will help us identify in a value stream all these 8 waste. So you can remember these waste by acronym team words, TIMWOODS, transportation waste, inventory, motion, but it needs a lot of thinking. For example, I always give an example of where would you find a printer in a office? The printer is not where it is required. The printer is where the socket is. And you will see people making hundreds of trips to the printer to take the printout. You multiply that hundreds of trips, multiply the time it takes, multiply by weeks, months. That's hundreds and hundreds of hours wasted in walking to the printer. A clear transportation waste, right? So it needs a very sometime you might have experience in a hospital. You go to a nurse, the nurse would take the vital and then she would ask you multiple questions. Then you go to another station, the another station will also ask the same questions. Then you go to another station, they will also ask you the same questions. So maybe asking questions, same question, just to validate 2 times is absolutely fine, but sometimes it's our processing waste. So we need to challenge each and every step. Sometimes we need to capture the same information in our EMR in multiple locations. The same is kept, same information is captured in one window, same information captured in another window. It's also our processing waste. So we'll deep dive slowly into all these types of waste. So I just want to do a quick exercise now. 5 minutes it will take. Sorry, it took a little bit more. A session is supposed to be of 60 minutes. So let's assume there's a OPD patient and We'll classify all these steps into value add and non-value added time. Let's say I have the times. Arrival registration take 10 minutes, waiting for doctor 30 minutes, doctor consultation 50 minutes, then transferring to the lab, walking to the lab 5 minutes, and so on and so forth. So all of you need to tell me what do you think it's a value add activity or a non-value add activity. But this is an exercise, but this is what typically happens in a hospital. It's a very general flow. So what do you think from a patient point of view? Arrival and registration is a value add or non-value add activity from patient point of view?
Non-value added activity.
Absolutely. Why? It is essential for process, no doubt about it. But from the patient's perspective, it does not directly add to the health outcomes. It's an administrative necessity. Have you seen patient getting irritated standing in front of reception sometimes? Though it is, we need to do register the patient, but patient really get agitated and irritated and upset, why are you doing this? Why are you asking so many questions? Why it is taking time? Now the next step, registration is done. Waiting for doctor consultation. Is it value add or
Non-value,
non-value add?
non-value added.
Okay,
Value added.
perfect. It's a pure waste. I don't need to discuss about it. How about the doctor consultation?
Value added.
Value added.
Perfect. Because it's a direct interaction where diagnosis, treatment planning, medical advice are provided. Then the doctor says, go and do some labs. Now patient is walking to the lab. Is it value add or a non-value add?
Non-value added.
Fair enough. Because it's a movement based. While it is necessary to go to the lab, but walking itself does not add value. How about somebody coming to the patient and collecting the blood? How about the phlebotomy area is just the next door to the doctor's clinic. It's not in some other corner, right? Now you can start thinking about, you may not eliminate the waste, but you can minimize the waste. Now the lab is done. You're waiting for lab test. Value add or non-value add?
Non-value added.
And value added.
Perfect. It's a pure waste. We don't need to discuss. Now the lab test is done. Basically
Value
now
Value
it's a
added.
value. Yeah. Because now it's a direct action which is transforming something. If you don't do the lab test, how would you get some information? So it's a direct action to gather diagnostic information. And usually I would tell, I don't know if there's a doctor here, then I think Dr. Weil is here. Dr. Weil, how long a lab takes to do the CBC as a process?
Like 10 minutes, by the way.
Yeah. But how long it take you get the CBC results?
4 hours.
So this is let make it 10 minutes since Dr. Weil is saying 10 minutes. So it's a direct action, right? Now waiting for test results is a value add or non-value add?
Non-value added.
Non
Perfect. Pure waste. Now the doctor says, come back to me. I want to see the results. Is it value add or non-value add?
Value added.
Yeah. Because now the doctor is about discussion of the results, adjustment of the treatment plan or advice. Now the patient walk to the pharmacy to collect the medicine. Value add or non-value add?
Value added.
value added.
See, now it doesn't directly doesn't improve the outcome. It is necessary, right? But collecting medication itself is an administrative logistical step. How about a medication being delivered to the patient itself instead of patient walking to the pharmacy or waiting in pharmacy? So from patient point of view, it's necessary, but you would see why would you see a patient in a pharmacy getting irritated? If the patient thinks it's a value add activity, why is getting so irritated and frustrated in pharmacy? Because for him, the value add activity is when the medicine is in his hands, not the process of taking the medication. Patient doesn't want to wait. That process where actually we ask a patient to go to a pharmacy, collect the medication, the patient doesn't patient it's necessary, but it doesn't please the patient. From a value added point of view, the value added activity is when the medication is in the hand of the patient. It will
Alam
take
sir, I
you.
have a question for this.
Yes, Sachin.
For the question, for example, the guest, some things are not covered in the insurance and all like that. So guest has to pay for the cash. So I think it's value added.
No, okay, okay. So getting the service delivered is a valued activity when actually you hand over the medication to the patient. Either it is cash or insurance, doesn't matter.
Okay.
Now the whole process, the process it takes from pharmacy prescriptions being ordered until the medicine is in the hand of a patient, this whole process patient looks at it as a non-value added activity. How about even if cash? I would challenge the process. I would say, why not we collect the payment then and there itself? Why not we have some other alternative? So the point is that I'm not going to go into it. It's a food for thought. I mean, sometimes it takes a lot of thinking to challenge our own assumptions that what I was thinking is a value add is actually a non-value add. The last step is payment and billing. Is a value add or non-value add?
Non-value added.
Yeah, it again is administrative necessity, but it is not directly adding value to the patient. The only three activities which actually in this whole journey was adding value to the patient, which is actually transforming input into some output, was the doctor consultation, where the doctor took the inputs from the patients and gave some advice. The another was lab test, when actually the sample was being analyzed to determine the information. And then again, the follow-up consultation, when actually the doctor had a look at the results and discuss the treatment plan. From a patient point of view, only these activities are value added. Now, all other activities, we need to do it. These are essential for process, but these are not adding value to the patient directly. So the question is not that, oh, how can we run a hospital without doing all of this? No, no, you need to run a hospital doing all of this. But we need to think about right now in this total journey of 3 hours, the value added time was 35 minutes, which is basically 19.44, and 80.56% was non-valued time, which is a very realistic thing. If you map any patient journey in a hospital, you would see this. Now the question is not to make this zero. The question is, can you do something to make it 5? Can you do something to reduce it to 5? Can you reduce this to 1 minute? Can you reduce this to 5 minutes? Can you reduce this to 30 minutes? Can you reduce this to 5 minutes? Can you reduce this to 5 minutes so that you reduce the non-valued time from 80%, 83% to 61%? And coming back to the last principle, pursue perfection like a pit stop. And you keep on challenging this. No, I found a way that my waiting for test result is now reduced to 5. You found a way that this is just a matter of a minute, and you keep on challenging it. You keep on improving the value added time. You keep on reducing the non-value added time. This is the last principle: pursue perfection. We're not asking you to be perfect from day one, but once you understand the concept of this activity is a non-value added activity, even you have to do this, you cannot eliminate it. You need to keep thinking about it. How can you minimize the waste in that area? So this is where we close the session. I'm sorry it took another extra 12 minutes because I wanted to close this exercise. If you have any questions, please do ask. If you don't have, you're welcome to leave the session. I'll share the recording in the group. I'll stay here for another 5 to 10 minutes. If anybody wants to ask any question, I'm here to answer. Thank you, everyone. Thank you.
Thank you, sir.
I got a question. You know, where you have mentioned the over processing waste in the last slide. So basically, I'm gonna share with me. I had my bone chipped. My knee bone got chipped. In X-ray, it didn't came, and then it took another 2 weeks to process the information, and then oh, okay, let's go do the MRI. But at that very early stage, if we have the resources available to us, because some things, because it's a bone got chipped is not a usual thing in a body. I'm a
Correct.
badminton player, so it took me another 4 weeks to get to the result. Oh yes, my knee bone got chipped from two places, and the bone fragments gone under the kneecap, which didn't came in X-ray. When went to emergency, and New Zealand's medical health is like very shit. It's 8 hours wait. So, anyways, so if we have resources, is that over processing waste? If doctor is saying, hey, again, it comes under a skilled kind of a skill of a doctor to get order that MRI straight away after the X-ray, or if after the X-ray if it's not been done, the diagnosis not being found, they could have been ordered straight away.
So,
So
okay. Yeah, yeah, please continue. Yeah.
yeah, so over processing waste, how, like, what's the probability where we are putting that extra MRI in like, if say doctor is asking for 2 or 3 different tests for most of the patients, and out of 10, 8 of them are getting different results on a second test, on a third test, what's the probability we're gonna put that out of the over processing waste?
Okay. So, okay, when I actually give an example of that, something that could have been figured out through X-ray, but why do we have to do MRI? So intention is not to create levels. It's not that you have to do X-ray, then you need to do ultrasound, and you need to do MRI, and you need to do CT scan. That's not the intention. Our processing is that anything that does not add value, right? Now, in this case, let's say if based on your, or whatever diagnosis, if doctor realized that, MRI is the right thing to do, and he ended up doing the X-ray first. So in this
Yeah.
case, the X-ray becomes the our processing.
Oh yeah, 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 yeah.
This is what I wanted to say. So it's what is required at that point of time to
Yeah.
deliver value to the patient. So in this case, he should have directly gone ahead with MRI instead of doing an X-ray, because the probability based on the diagnosis and the symptoms and everything, that MRI would give more information rather than an X-ray. So in this case, X-ray is an our processing waste, but
Oh
MRI
yeah.
is a value adding activity. I hope that
All
answer
right.
the
Okay.
question. It's
No,
not
no,
a
no.
sequence
That's
of event. Yeah,
yeah. No, no,
yeah.
no, no.
Okay.
It's correctly. Yeah, 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 yeah. But another on this part, like in New Zealand, our healthcare system is free. w- I I
Okay.
I I'm sorry, I'm taking more time. So here I think we don't see any figures. We don't see any numbers. We don't have any $2, $5 for that, $3 for that, $20. Usually in our healthcare, especially in emergency setting, we don't have any monetary value at all to seen to a customer. Like me, I'm going in emergency. It's free of cost. My X-ray is gonna free. My MRI. That's why MRI took like my MRI came after 4 weeks because it's a long,
Okay.
lengthy process to get to MRI. That's why I think doctor might have done the X-ray first. And
Mm-hmm.
like in this kind of setting where monetary value is not, um, value is like no, it's a kind of value added process, but customer is not paying anything. It's a government is paying everything,
Right.
but it's a very lengthy process. Does we still use all this process in that kind of setting where
See,
customer is not
see,
paying, government is paying on behalf of customer?
see, absolutely fine. See, sometimes we, okay, so the two things. First of all, the lean is about minimizing the cost and optimizing the outcome, right? That
Yeah.
is the first principle. Now, wherever actually in many healthcare setup, many government driven entities, the cost is something which is not visible. Though cost is not something which is not important. The cost is still important because it's a healthcare cost, but directly going to the government agencies. But let's say we don't have the visibility. So what we need to figure out is that the lead time to deliver the outcome from start to end and
Yeah.
optimize it.
Yeah.
So then we go to the second thing, which is about we need to map the whole value stream from the start point until the end point, and we need to think about how can we minimize the lead time. Forget about the cost. How can we
Mhm.
deliver the outcome faster? So then it's about lead time.
Okay, now it's given me. Yep. Thank you. Thank you.
Perfect. Anyone else has any question, please? All right. Thank you, everyone. I will share some resources after the session in the group. And inshallah, we'll see again. We'll meet again next week on Saturday. Thank you. Have a nice day.
Thanks, Mama.
Thank you. Thank you.